Hi there. Welcome to IV Disease Management. My name is Dr. STD. What brings you into the clinic today?
Hey Dr. STD, we're here because today was supposed to be the happiest day of our lives. Our wedding day. But I just found out this idiot has been cheating on me for months. To top it off, now he has the nerve to tell me he thinks he might have some STD. He has all these symptoms and we've tried WebMD but we can't figure out what it is. Do you think you can help us?
Of course I can. You came to the right place. I treat many types of STDs every day. Let's get started by getting you registered and we'll head to my office. So just FYI, today I have some nursing students with me. I know I already told you what STD you have, but I want them to try to diagnose you too. Is that okay?
Yes. That's perfectly fine as long as I can get something to make me feel better and they get a chance to learn. Let's get started.
To help you guys out, I'm going to give you just a few facts to help give you a background for this patient before he tells you his symptoms and concerns. It may help to pay attention. So to start off, the STI this patient has happens to be primarily transmitted through sexual activity in young adults. Within the US, this STI happens to be the second most common disease and is caused by a bacterial agent as opposed to a viral agent. Lastly, back in 2018, the CDC reported that about 1.6 million new cases arose of this disease and more than half of those infected patients were between the ages of 15 to 24 years old. Crazy, right? Now for the rest of the information, I'll let our patient tell you about his condition. Let's go have a chat with him. To help the process along, I'll ask the patient questions and you guys just sit back and observe. Make sure to pay attention though, because there may be a few more Kahoot questions along the way. To start off, why don't you let the students know how you got this infection? Also, feel free to let them know other ways they can get this disease and what situations to avoid to prevent transmission of this STI.
Well, I guess there's no point in trying to hide it anymore. My wife already told half the world about it, so what do I have left to lose? So like my wife mentioned, I've been having an affair for a few months now. The doctor mentioned that my STD is primarily transmitted through sexual contact or contact with any bodily fluids. This includes any interaction between the penis, vagina, mouth, and even rectum of any infected patients. That makes sense in my case because I had sexual intercourse during my affair. I never thought it would happen to me though because I thought STDs were just spread through blood touching blood. Guess my sexual education isn't very accurate, is it? Anyways, the doctor also mentioned that if my partner happens to be pregnant, there is a high chance of the infection being passed on to her baby if they deliver vaginally. He mentioned there is some eye ointment that you guys use after delivery, but I forgot the name. I'll let him explain that later. The last thing I remember him telling me too was that even after treatment, I can be reinfected if I come into contact with any people who are currently positive with this STD. Guess that means I have to be careful in the future.
That's all very true. I'm glad you understand how serious STI protection is now. Now let's move on and we'll let the students know about common signs and symptoms of this STI. Although you're a man, we'll cover both men and women just to be thorough.
Sure thing, doctor. I'll go ahead and list out my symptoms first, so let's start with the male presentation. So in my case, I happen to be one of the unlucky ones and actually had very uncomfortable symptoms. Guess that's karma for cheating, right? Although most men tend to be asymptomatic, I actually had a lot of pain when I peed. Aside from pain, I even had some trouble peeing due to the swelling of my penis, which the doctor called dysuria. Along with that, I also had what looked like pus coming out of the urethra of my penis. I noticed it a few days after I was infected, but the doctor said it can show up anywhere from 1 to 14 days later. It was a yellowish green color and just looked gross. That's what has me the most concerned. These symptoms are pretty much due to infection of the urethra, and in some cases, this infection can even turn into epididymitis, a rectal infection, or even a pharyngeal infection. If epididymitis occurs, some testicular pain can also be experienced, but in my case, That did not happen. I also had no symptoms of rectal infection or pharyngeal infection either. Guess I got sort of lucky. Now that we covered men, we'll move on towards women. Similar to men, women also tend to be asymptomatic when it comes to this STI. If by chance the woman does begin to show symptoms of infection, these tend to be very mild and generalized symptoms. Because of this, many women tend to be misdiagnosed with vaginal or bladder infections instead of the STI, which only prolongs treatment or may even lead to a diagnosis never being made to treat the STI at all. If present, these symptoms tend to be difficulty urinating known as dysuria, increased vaginal discharge, and also transient vaginal bleeding between menstrual cycles known as metrorrhagia. If complicated, the women may also show signs of rectal infection and pharyngeal infection, however these tend to be less likely to occur. Now that we covered both men and women, let's see who was paying attention.
Great job. Now let's go over the possible complications and long-term effects this STI can have on both men and women. Then, we'll wrap it up with how we're gonna treat your STI so we can get you on your way.
Sounds good. So when it comes to complications, this STI can have some pretty gnarly long-term effects in both genders. In women, this STI can easily spread into the uterus or even the fallopian tubes. If infection of these structures does occur, the woman is at high risk for developing pelvic inflammatory disease. In PID, the women can develop abscesses, chronic pelvic pain, increased risk of ectopic pregnancy, and even infertility if the scarring is severe enough. In men, like mentioned earlier, they can develop infection of the epididymis known as epididymitis. This condition is very serious because it can also cause infertility in infected men just like PID in women. In both men and women though, their chances of developing HIV increase exponentially, so they become more at risk for STIs in the future and possibly even AIDS. Guess it pays to be safe now, rather than sorry later.
Now that we've gone over transmission, signs and symptoms, and complications, we'll just cover the course of treatment for this STI, and conclude with the causative agent of this disease. We intentionally only listed part of the bacteria's name because we're afraid it may give our STI away since it sounds very similar to the STI name. In infected patients, the expected course of treatment is an intramuscular injection of ceftriaxone, 500 mg in one dose. However, to be most effective, both partners must be treated to prevent reinfection. This is the key to eliminate further infection of other individuals. Also, as mentioned earlier, there is an eye ointment that has become universally used as prophylaxis for eye infections in newborns. This eye infection is known as ophthalmia neonatorum and can cause purulent drainage, corneal perforations, blindness, and even death. The ointment used to prevent this complication is erythromycin ophthalmic ointment and is instilled within 1 hour after birth in all newborns. As you can tell, this STI is no joke. Finally, to conclude our appointment, we're going to reveal to our students what the culprit behind this STI is. So after running our labs, we determined that our causative agent is Neisseria blank bacterium. The tests used to diagnose this STI are nucleic acid amplification tests. All that's required is a simple vaginal or urethral discharge swab, and we're able to diagnose our patients fairly quickly. We've also decided to include a picture just so you can see how terrifying this bacteria is up close. Look at it, it even looks scary, doesn't it? Well, that concludes our visit today. We're going to go ahead and discharge our patient and send him on his way. Thanks for your help.
See you later, loser.